Very helpful, encouraged me to email her with all of my questions, and she was researching all the information and getting back to me. So everyone has been really nice, and Dr. Lodi called me a couple of times, and usually you don't have the doctor call you. It's somebody from the staff or a nurse or somebody like that. But he actually called me in person a couple of times just to talk to me and say, okay, well, do you have any other questions? How can I help you? And we talked a little bit about feeding the cancer and all of that kind of stuff. And I'm very fortunate. I have a brother that lives in Phoenix, so I could stay with him while I was doing the treatment. Originally, we had talked about 10 weeks with one IPT treatment a week, and I had mentally kind of, excuse me, prepared for 6 weeks. So we doubled up on the IPT treatments, and I did a Tuesday, Thursday type of regimen for IPT, which worked out really well. And he was very flexible. I said, well, I wasn't sure about the cumulative effects of IPT. I was worried about hair loss, and I was worried about the nausea. It's still chemotherapy. It's a much, much lower dose than traditionally what is prescribed. So I was really concerned about that. And then the whole piece for me, the emotional piece about the poison. I mean, chemotherapy is poison. Depends on how it's administered and how you support your body in the meantime. Traditional therapy doesn't support your body at all through vitamin C and ozone therapy and chelation, all of those, colonics, all of those things that really help your body to flush out those toxins, the excess chemotherapy and just the toxins in general, the juice fast. I mean, none of that stuff is recommended by traditional therapists. So all of those things, this is a loving environment and they're very supportive of you. When I first came, walked in the door and there's hustle bustle, the nurses running around and people plugged up to IV poles. It's a very small, intimate couple of living rooms, and it's not a hospital environment at all, which I think really kind of takes the pressure and that whole emotional piece. Like, oh gosh, I was worried about the whole sterile environment, having to be hooked up to all these tubes, and it's just very relaxed, and people are nice, and patients all have developed a camaraderie, and we've exchanged emails and addresses, and we talk about food and recipes, and even though some people are juice fasting, we can still talk about food, and Colleen also helps with food preparation, and she encourages people to come over and say, oh yeah, get your, roll up your sleeves and get your hands in there, and we're going to teach you how to make hummus, and is there anything that you want to make, something in your life that you think would be a good thing, maybe something, well, like my kids, they really like things like tuna salad and egg salad, and there are actually recipes to make a mock tuna salad and eggless egg salad. And so last Thursday when they did the food demo, that's what I was doing. I was making all that stuff. Colleen said, here's the recipe. So we were in the kitchen, and she was making something else, and I was making that, and it was perfect. We served it to the staff and all the patients, and they were all raving about it and how good it was. And let me tell you, there was about 3 tablespoons left. So, and we made a double batch. So I think it went pretty well. But I would encourage anyone, I mean, at least just to look at the videos and to talk to people. There's some books out there. They have a list of recommended reading that's really good, and I'm sure they would be willing to give you that list over the phone. You don't even have to come here to fly out here. Just ask for that recommended reading list. There's some videos that you can watch, some DVDs that also they could send you a copy of, which are very informative, very helpful. Patients here are more than willing to talk to people and tell you their story, as I'm willing to do today. And as it turns out, I was supposed to be here 6 weeks, and I'm going to be here only 5. I'm actually going home Christmas Day to surprise my children. They think I'm going to be gone. So that's kind of a nice surprise. Sorry. I had a PET scan last week, and again, it's the whole radiation piece which kind of freaked me out, but I did one freak out at a time for me, and it turns out that the PET scan came back clear, so they don't see any active cancer anywhere, which is really great news. I did have my tumors removed before I came here. That was something that I opted to do for my personal choice, but I know there are other patients here who didn't do that and are recovering without surgery. I mean, it's amazing that you're able to do this. Dissolve the cancer, stop it in its tracks, and it's an idea of stop making the cancer and it can't grow. And what you're doing through the food protocol that Dr. Lodi and his staff recommend, it works. And that's the best thing you can do. I think another important piece is that it's important to realize whatever happened in your life before brought you to this point. Cancer, basically. Once you leave here and you're well, you can't go back to that person that you were before. You can't go back, because that's what brought you to this point. You need to make that commitment to be well and be healthy and follow the protocol, and because that's what's going to make you well and keep you well. And that's a really important piece. If you can wrap your mind around that concept, then you'll be just fine. So I encourage people to call or come down if you live close, and just visit the clinic and talk to the staff, and they're all willing to talk to you. Talk to the patients, they're all willing to talk to you. They've seen miracles happen, and I think that's important. We all could use miracles in our life. Thanks and good luck.